Welcome to Startup Health TV, where we celebrate the entrepreneurs and innovators who are transforming health. I'm Logan Plaster. My guest today is Matt Swanson, the CEO and founder of Reciprocity Health. Matt, great to see you.
Great to see you, Logan. Thank you.
I'm fascinated by the work you're doing. I got to know you over the summer and learn about how you're applying smart financial incentives to help people make healthy decisions. Let's break it down and really explain to us what Reciprocity Health is doing.
Yeah, so specifically in the Medicaid space, we're really seeing low adherence as a vexing problem across the board. And what you really see when you break down the data is that fewer than 50% of people actually adopt a care program that's being offered to them. Yeah. And among those people, less than 50% of people actually stick with the program. So when you know all of the amazing innovations that are happening out there in clinical care, helping people drive better health outcomes, it's really sad to see that that innovation is often going unused. And so what we've done is we've taken CMS field-tested research on the power of financial incentives being paid to patients and overcome the fact that part of that CMS study showed how complicated the work was. Some of the people at CMS that we've spoken to have said there was no chance for this work to get commercialized because of the complexity.
It works, it can't be done.
Well, health plans and health systems, they all have their job to do. They don't have a robust marketing department.
Yeah.
So we're really building ourselves to be that specialized capacity builder for those plans and for those health systems to really activate people that are on the sidelines and bring them into the care, draw them towards their care, and have a much higher level of participation.
You're shining a light on a really fascinating part of innovation, because you can have all the great products in the world, and if people don't adopt it,
that's right.
Then what good is it? We're at a conference full of innovation, and yet you're saying like half of people are adopting something important, and of that, even fewer following through. So you got to start at the right place. Step one, get people to.
We were looked at with one of our payer relationships. They had an amazing high-risk maternal health program that they were offering to moms in their second and third trimester, Medicaid population. They had a 3% adoption rate for the program. It's a free program with amazing health outcomes, avoiding the NICU, healthy birth for mom and baby, and they just could not get the uptake. And so that's the challenge that we really took on. And we decided that we would build a platform and a company around the complexity that CMS had showcased and allow for that work to really be brought to bear.
Now, you're not the first company to think about financial incentives for healthy decisions, but I understand you're taking a more savvy approach, or a more fine-tuned sort of economic theory sort of approach.
Yep.
Tell me about sort of the backbone of it.
Yep. So it really comes down to efficiency of being able to really tailor interventions for any care program in a really effective way. So you can offer financial incentives thinking it's going to be a silver bullet, but it really isn't. You really need to wrap it around with the right communications, the right framing, and the right outreach. So we have a platform we call the CARE platform. It stands for Choice Architecture and Responsive Engagement. That's a behavioral economics term and a consumer science term married together.
Got it.
Because we have the capabilities to be building the programs based on behavioral economics, the reward design, but then you also need to have the digital outreach, the consumer segmentation, understanding consumer journeys, understanding omnichannel messaging. That all needs to be coordinated, because without it being done all together, it's really going to fall flat. So the platforms that it allows our team to build these campaigns for any care journey. It might be high-risk maternal health or diabetes management, chronic condition management. It might be an episode of care. It might be a transition of care, like a hospital discharge. And so we create that financial incentive overlay, breaking it down and gamifying it, making it easy to follow, and then we do the outreach. We have a different value proposition for that member, saying you have a wonderful care program available to you, but now you can also earn $120.
Yeah.
And so getting into those complex care journeys does two things. It delivers that really important care, but it also allows for much higher levels of reward. The ROI of spending $200 on a high-risk maternal health journey is apparent when you're avoiding the NICU, right? But then it also activates a mom much more convincingly than a $25 Amazon gift card,
Yeah,
right? So
it's real money.
$200 opportunity.
Yeah.
We've got, with our Medicaid families, one of the other things we learned over time is that in communication, showing each individual exactly what they can earn is really important and compelling, and we had great results with that. But what's even more effective is bundling it up to the household level and telling mom or dad that your family can earn $800 if the kids do this and this and this, and you do your well visits and all that.
Yeah.
And so talk about drawing people out of the woodwork towards these programs.
Yeah.
That's really compelling.
Well, it's one thing that's fascinating to me about this idea of the care journey and this, the customer journey almost, is that you come from the e-commerce side, and it really kind of mirrors in an interesting way that customer journey, the idea of an abandoned shopping cart.
Exactly.
What's the wording you use? How do you draw them through this process? So tell me about how you're kind of bringing some of that wisdom to healthcare.
Well, I do have an e-commerce background, but I will admit most of that consumer science, consumer research, and outreach is coming from my co-founder, John Silvan, who has spent decades in developing consumer research for consumer packaged goods. That was his entire career before we drove him into this role. He came willingly because he knew the consumerism of healthcare was something that was really lagging. And had so much opportunity. So you marry that expertise with the behavioral economics and the financial incentives, that's really where the magic happens. We've been brought in with a focus on a Medicaid population numbering well over 100,000. And with our approach, we have driven 10 times the monthly enrollment rate of the prior rewards vendor.
Yeah.
We've tripled cervical cancer screenings. We've doubled mammograms. And we've more than doubled primary care visits just by having this opportunity, again, at the household level. Wow. You activate the entire family, and it's very motivational for them to see that they can earn those rewards and then have the freedom to spend them where they really need it to be spent.
If the numbers add up like you're describing, it seems like a no-brainer for some of these major partners. Are they lining up? Are they seeing the light?
Yeah, absolutely. I would say it was a bit slow. We had our first sort of cornerstone client, Highmark Blue Cross Blue Shield, launched in late 2022. And so when we started saying what we could do, we certainly got a lot of interest, people paying attention. But now, a year later, with all the performance data that's coming out, now we can show what we have done.
Yeah.
And now, yes, people absolutely lining up, because the programming that we do is, as I said before, tailored to their specific needs. So one particular health plan may be struggling with hospital readmission or asthma medication. Another one may be struggling with high-risk maternal health and diabetes management. So we're not selling off-the-shelf solutions. Yeah. We're trying to find out where people's priorities are, where they have wonderful clinical programs that are underperforming just due to adoption problems. And then we take that curriculum and we create this overlay and program that can really help those programs succeed.
Nice. So what's next for Reciprocity?
Well, we do have a big pipeline of multi-state MCOs. Okay. Those are going to be really interesting because every state's different. Every MCO is different, every list of priorities. So really bringing on new clients is a really exciting time for us because we know we have the capability and the capacity and the care platform can scale to any population size. But really understanding that variation across the markets is going to be fascinating for us. And then really understanding the nuances of each community. What we have is an ability to partner with community-based organizations because one of the ways that we invite people to the program, especially late in the year, you have families that have actually already done many of the things on their checklist and have already won the rewards that are available to them. They just don't know about it.
Interesting.
So we come to them and we say, you should sign up because you can earn $50 more by doing X, Y, and Z. And oh, by the way, you already have $200 waiting for you because you already did these other things. So what we do in the community is we work with the housing authority or faith-based organizations, and we let them tell their members about our program because it's like being Santa Claus. You're going out and you're giving money to people who desperately need it and giving them a roadmap to earn more and be healthier.
It's exciting. It's very cool. And they get the money in what form?
So a variety of forms, but the most powerful behavioral economics driver is spendable money. So people can really put that money to use in their most meaningful way. So we have a smart reloadable debit card that has guardrails built in. Casinos, alcohol, tobacco, firearms you cannot purchase with the card. We can actually tailor that down to specific SKUs or categories like healthy foods and things like that. That depends on the client. But that card is really important because it's branded to the client. So you're building that rewards program, positive equity with the member between the payer and their membership. But it also becomes an avenue towards other programs. So if a family signs up for a standard rewards program to do their primary care visits and their well visits and get their lead screen for their kids, that's wonderful. But then when somebody goes to the hospital or somebody is diagnosed with diabetes, new plans just pop into their app and show them you've got another opportunity to earn more rewards. So it becomes an avenue to really engage people when they need that extra care. And so it's really important that you have that continuity of a single card where all these programs can wrap up. And build that continuity of brand for our clients.
That's amazing. Matt, it feels like a real win-win-win. The fact that it's real money for these families, it's not a $20 gift card here.
Right.
Something that you could really actually go out and buy some Christmas presents with, like something you can really make a little difference in your life for that month. Is really two sides of the coin. So
exactly.
Amazing. So Matt, it's going to be exciting to watch your development in 2024 as people really get this idea. It kind of makes sense to them, and they line up to start incentivizing their folks.
Yeah, we're really looking forward to it.
Matt, thanks for the update.
Thanks, Logan.
All right.